Καλησπέρα σε όλους. Είμαι Ελπιδοφόρος Σουτριάδης, ακαδημαϊκός υπεύθυνος του Προγράμματος Διοίκησης Μονάδων Υγείας και έχω τη χαρά σήμερα να καλωσορίσω τον Dr Rami Saadeh από το Technical University of Jordan of Science and Technology, το Jordan University of Science and Technology, ο οποίος θα μας μιλήσει για ένα πολύ σημαντικό θέμα που σχετίζεται με τη δημόσια υγεία και τις κρίσεις στη δημόσια υγεία, ένα εξαιρετικά επίκαιρο θέμα εν το μέσο της επιδημίας του κορονοϊού, την οποία έχουμε ζήσει τα τελευταία 2 χρόνια. Ο τίτλος της ομιλίας του είναι Leadership in Public Health Management and Public Health Crises. Ο Rami Saadeh είναι επίκουρος καθηγητής στο Jordan University of Science and Technology. Πήρε το πτυχίο του στην Ιατρική από το ίδιο πανεπιστήμιο στην Ιορδανία και αργότερα συνέχισε τις σπουδές του με μεταπτυχιακό τίτλο στην δημόσια υγεία από το Tulane University στις Ηνωμένες Πολιτείες της Αμερικής και επίσης πήρε διδακτορικό στην περιβαλλοντική υγεία και την επιδημιολογία από το Indiana University, επίσης στις Ηνωμένες Πολιτείες της Αμερικής. Επιπλέον, ο Dr Saadeh έχει ολοκληρώσει την κλινική εκπαίδευση σε πρόγραμμα οδοντιατρικής, αλλά και σε πρόγραμμα δημόσιας υγείας στο Πανεπιστήμιο του Τέξας, στο Σαν Αντώνιο, στις Ηνωμένες Πολιτείες της Αμερικής. Ο Dr Saadeh επικεντρώνει την ερευνητική του δραστηριότητα σε περιβαλλοντική υγεία και κοινωνιολογία της υγείας και στις ανισότητες της υγείας που αφορούν τις κοινότητες με ιδιαίτερη έμφαση σε ευάλωτους πληθυσμούς όπως είναι τα παιδιά, ηλικιωμένοι και άλλοι πληθυσμοί με χαμηλό κοινωνικο-οικονομικό επίπεδο. Ο Dr Saadeh διδάσκει διάφορα αντικείμενα όπως η βιοστατιστική, η διοίκηση θεμάτων υγείας και άλλα μαθήματα στο Πανεπιστήμιο Science and Technology της Ιορδανίας και έχει επίσης ιδιαίτερη δραστηριότητα με διεθνείς συνεργασίες. Είμαστε ιδιαίτερα ευχαριστημένοι και χαρούμενοι που τον έχουμε μαζί μας. Έχει δώσει 3 πολύ σημαντικές διαλέξεις τις τελευταίες 3 μέρες. Σήμερα δίνει μια υβριδική διάλεξη μέσω διαδικτύου, αλλά και εδώ στην αίθουσα του 4ου ορόφου του Ανοικτού Πανεπιστημίου Κύπρου. Και είμαστε έτοιμοι να τον ακούσουμε για αυτή την πολύ σημαντική διάλεξη απόψε. Thank you, Dr. Saadeh, for your collaboration and your visit in our university. We'll be happy to listen to your lecture tonight as well. Ευχαριστούμε όλους οι οποίοι είναι μαζί μας σήμερα για να ακούσουν τη διάλεξη. Dr. Saadeh, please.
Hello everyone, this is Rami. Thank you, Dr. Sutariadis, for introducing me. I'm very happy to be today and sharing the humble knowledge that I collected regarding leadership in public health and public health management, especially focusing about the crisis that happened because of the COVID-19 and the importance of the leadership during this crisis. So the leadership is a very wide topic and very important topic at the same time. There is no way that we can cover everything that has to do with the leadership in public health and leadership in general. But we will try to touch base on some important points regarding leadership in general, leadership in public health, and the importance of leadership during the pandemic, and ways of improving the role of leadership in similar pandemics if ever happens. If we would like just to generally overview the leadership concept. Leadership is when somebody is trying to change people mindset, behavior, attitude, and action to move them from one place to another place for a certain and specific objective. So this person actually is an inspirator, is a motivator, is somebody who can stimulate people's thinking and be able to change the way they think in a way that would be able to be self-motivated and work toward a certain goal or objective. If you look at this nice paragraph here at the bottom of this second slide, you would notice that there is some sort of reverse relationship between leaders and followers. And again, I'm sorry that the slide should be well covered, but because of the slideshow, you don't see the bottom of it. So actually, the red line is for followers and the blue line is for leaders. So the responsibility level of the followers without leaders, so this is 0 leaders, or if you don't have any leaders in the community or the population, the level of responsibility that overshed or been given to the followers is very high. So the followers, basically, or the general people, the public, are responsible for their actions, for their decisions, for the direction they choose, and for the objective they follow. They have a very high level of responsibility. They feel very overwhelmed with life responsibility, health decisions, and behaviors. And imagine if this ever has to be taken during a crisis, how the followers will be able to think and be guided. In case we have more leaders, and the word leader is not any leader, you know, the leader is somebody who has been having this effective leadership that can motivate people and change the behavior to be a healthy and a good one in a way that can reach objectives, general objectives, and specific objectives. So if we have more leaders, as you can see in the blue line, the breadth of responsibility or the level of responsibility that the followers or the general public hold and has to be responsible for decreases. So with more followers, or with more effective leaders, we will see the level of responsibility decreases. So what you can tell is when you have a good leadership, it will take the burden of holding responsibility and being responsible for the actions and behaviors out of the shoulders of the followers and public, and make them safely led by the leaders. So the leader is somebody you can safely follow and be able to trust. So this is another figure that shows the importance of the leader. The leader, he's a big figure, in red, who can see because of the vision, the big, not large in size, large in vision, large in mission, and large in holding and being able to tolerate responsibility. So this one with the vision, responsibility, burden, toleration, and the mentality could lead other people to the direction that people can safely and easily go to. Imagine that how you think about your parents. Your parents basically are the first leaders in a child's life. You trust them peacefully, easily, completely, and you follow their directions because you believe, there is a belief behind this, that your parents, your father or mother, can safely and easily guide you toward the goals that you need and the goals that will be beneficial for you, for the rest of your life. So this is how people think about leaders, effective leaders, truthful leaders, leaders who can really work toward the interest of the community, not against their interest. There are some specific features or characteristics for leaders, and we are again only kind of describing a general leadership and the general concept of leaders and leadership. Leaders have some characteristics that mainly they are born with. They are intelligent. Of course, you will not have an intelligent leader. Leaders are characteristically intelligent, Dominance, they have this ability to dominate their personality, dominate their decision, their intelligence, their skills. Adaptability, they are very easily adapted in any environment, so they can mingle and be able to change. Persistence, they have this sort of continuity and persistence toward achieving goals and moving people toward their secure place. Integrity, they are they have self-integrity. They are from inside. They have this sound intention and good thinking. So this is what integrity is. Integrity, and when you have this good, peaceful, and pure intentions. And also, generally, in general, leaders usually have good socioeconomic status. They are well respected in their community, well respected in the society. They have good social skills and good social connections. So socioeconomic status is good, educationally well established, and other good socioeconomic status. Self-confidence. Of course, they will not have a leader who is his confidence is shaking and not be able to take decisions in a confident manner. So basically, these are all characteristics that you usually find in leaders. The leaders themselves don't know how they got it. They got it as part of their personality, maybe over time, maybe because of the way they grew up. But these things are basically things I call born with, because you will see differences between these characteristics and characteristics that can be trained or learned. So we can build the leaders, but these characteristics are basically things that you cannot easily make or put inside the persons. They are things that the person come built in as part of the personality and part of their integral part of their structure and personality. So leadership actually has these steps that move people forward. And when I put VS, that means there is a difference between leadership and management, and we will come to this in a minute. So the leader actually is able to set the direction, know where the people go because of the mission, foreseeing, be able to see the future in a clear manner, and have the imagination of how things should go and should be. So they set direction, don't plan for it. They don't sit and make these strategic planning that usually managers do, but they set the direction and be able to see which direction the community and people should move forward to. Aligning is meaning almost like an organization, but aligning is unofficially organizing people toward moving to this direction. Aligning actually includes motivating people to gather and be able to work in a social manner toward the direction that the leadership has set forward. And then motivation. So after you see the direction, you align people to move toward this direction or goal or intention, then you motivate them to act on this direction and be able to go forward to the goal. So this is basically the steps of leadership in a glance. Leadership levels. Now we will be talking about different levels of leadership, and this is very important. Leadership comes when you deal with individuals and groups. You can apply leadership at the organization level, then the governmental and national level, then global level. So if you put the leadership at the bottom, at the lower level, it's not the lower by value. This is the basic level of leadership when you deal with individuals and groups. So if you have a friends, some social community, in your religious or society groups, if you have your family, friends, as part of your social relationships, if you have this leadership ability, you can basically move them forward and be able to give them the insight and give them the spirit of changing themselves and changing their surroundings. So we will not be talking about this because this is more of a social leadership, and it's more specific than other ones. Because we now actually talking about public health and health administration, we will just basically touch base on other levels of leadership. The higher level of leadership is organization. So when you have this leadership ability and be able to practice your leadership within your organization or your institution. So if you work in an academic institution, and you work with a governmental institution, public, private, non-for-profit, any leader can, and actually a leader is mandatory to be there, to be able to move the organization for a place they will not be able to be moved by themselves. I want actually to mention something, that there might be a president or a general manager or CEO for any company or organization, but the CEO will see, or the president will basically keep the tasks and activities working, will be able to abide to the rules and regulations of the company or organization, will be able to make or keep the organization functional. But the one who's able to change the behavior, the mentality, be able to make people motivated and look for a better future are leaders. The third and higher level of organization, and higher level because you work with more people, you work on a greater scale, you work in a higher level of goals. So this is why you see the leadership level is changing. It's the governmental or national level. When you have a leadership position or leadership ability to change people in your nation, in your country, in your government, to make them be able to make better decisions, be able to work toward the benefit of the community. This is when you work on a governmental or national level. And there is some points I will mention here, because usually governmental things are a little bit tricky, especially during emergencies and crises. Global level, global leadership is very important. And I have a couple of slides talking about global leadership, how several global committees, global entities be able to lead the rest of the world to the safety and to the points where the world can better act and improve the health of the population of the country. So these are different levels of communities. If we talk about the second level, the basic one we'll touch base on today is the organization leadership. If you work in any organization, you might be a leader by position or a leader by ability. You might be a leader even if you are just simple employee, because you have these characteristics that I just mentioned: integrity, intelligence, directionality, motivation, confidence, etc. So if you compare the leadership roles to the management roles, you will see big differences. So managers in management, even the top managers, top level managers in any organizations, they are basically doing the managerial functions. And it's well known that there are 4 managerial functions: is to control the activities and tasks of the organization, to plan and make strategic planning and plan for the goals of the organization, to organize the people, organize the employees, and to lead them. So these are basic, regular, routine functions of the management. However, people in the leadership, or those who have leadership ability, don't do that. They basically inspire, self-motivate, empower people, make them feel good about themselves, make them guided, feel that they have a very noble goal in their life. So you might have a leader who's your colleague next to your door, or somebody who sits in the same office of yours in the organization. They are not managers, they are not top level managers, but they have the ability to make you, better guided, clearer in your vision, more empowered and self-motivated than the true supervisor or manager of your management. Managers basically have routine jobs. They just keep the rules, the regulations. And managers actually cannot go far away or avoid or forsake any kind of policies that has been set by their organization. So they follow the rules and they follow the regulations, which is great and good, but we are talking about different concepts. If you only follow the rules and regulations and don't try to make any creative changes in the people's life, you will keep people in a routine basis that might or might not improve to or make a change in the employee's life and employee's work and ability. In leadership, you basically create things. You basically try to develop new skills in people's and not necessarily abide to regulations. You don't follow certain rules, certain policy to make creative things, to make people more able. You are just basically trying to empower people to make changes in their lives and in their roles inside the organization. And there is something very important to mention, that leadership is not that you are trying to make employees in your or other colleagues in your organization think outside the scope of the organization. You are actually empowering people to think within the scope of organization. You are trying to make people work toward the organizational goals. So if you are in academia, basically you are trying to make people more contributors to the academia, do good type of research, teach well with motivation. You can make people voluntarily contribute to the community and be able to help other people because of the academic role. And you don't have to follow any rule or regulation, just basically inspiring people from the inside, which fall again within the organization's goals. So it's not that leadership goes against management. Both of them go parallel toward the organization goal, but leadership actually, if success happens in the leadership role, and if it was effective enough, it will be much faster and more effective to forward people and move them toward the organization goals. Management, again, is more of formal power and leading position. So you might be assigned as a leader, but you don't have leadership abilities. How many people you know in your life, in your organization, that was assigned as your leader, but they don't have any leadership abilities, or if not any, they have only maybe few leadership abilities, right? Leadership don't have a formal power. Again, you might not be in a position that you were assigned formally, but you still have a lot of power because of the personality and abilities you have. Of course, the management always think about the goals of organization. Leadership thinks about the organization, but more personal or group inspiration. So you improve the people themselves. You try to change them from the insides to work toward their goals and others' goals as well. So this is the leadership at the organizational level. I like this. I tried to make it as a way to see how leaders have more specific roles in public health than just in general public or public health, management. There's a proverb: a manager shuns you while a leader protects you. Again, if you have a supervisor or manager and you do a mistake, you usually get a punishment, or you will get accused for doing something wrong. The leader, by on the other side, will protect you, will show you the right direction, has nothing to actually control or try to judge your actions. They will tell you the right path, they will tell you the right way, and if something might happen, they protect you. And again, it's like a godfather or the spiritual leader or spiritual protector of your life. The leader is somebody who's trying to move you to the better position rather than control your actions and monitor your behavior. So if you think about the word public, the public, general public, which basically are citizens and community members, and then you add the word leader to them. So public leaders are those who try to make a better future for the public, a better future in their jobs, better future in their life, in their social life, so public life in general. If you think about the public health as an area or as a specialty, public health leader promote health and inspires citizens to change their health behavior. So if we have, we are all public health professionals, or have to do with public health in a way. So if we have leaders in public health, those actually people who are trying in a way to promote our health, and at the same time they are trying to inspire other citizens to change their health behavior. Now, to get more specific, public health management, and management basically is this field or science that try to practice the management skills and abilities within public health. So it's administrative and management abilities and skills that are applied within the field of public health. So management leaders or leaders of public health management, those who can be able and are able to make effective decisions, and we need them. We need leaders in public health management, in government, in the Ministry of Health, And we need them very bad. We need them during crisis, especially during the like pandemic that happened of COVID-19. Those are the leaders, because of their management skills, can make effective decisions. And when you have a public health crisis, leaders of public health crisis who have all other of public and public health leadership and public health management leadership, those are the ones who save our lives and protect us from the harm. So this is how the paradigm, the dialogue goes with every time you add a leader in any kind of specialty. Okay, we said previously that there are some certain features or characteristics that are built in, the leaders born with. Is something inside those people who made them with talent, with leadership skills. But here, we have things that are tools, things that we can teach, things we can teach our kids, teach our students, teach ourselves, even teach our leaders. We will come to that very shortly. These are skills that if you develop, you will have leadership skills. From inside, you might have some sort of, poor confidence, or poor intelligence, or not, high level of intelligence. But once you learn these skills, you will be able to improve your leadership tools, and at least we will have more leaders. Because as we said, once we have more leaders, we will have less burden on the community, and the community will not be responsible for their actions. And you can read them, communication skills, active listening, and this is part of communication. Technology skills. Without technology skills like using a computer, the internet, be able to communicate through social media, you actually losing one of the tools that make you a better leader. Meeting skills. When you meet with people, be able to discuss their problems, be able to convince them of your opinion, be able to aggregate them and make them, agree or disagree on certain point. So these are also one of the leadership skills. Strategic planning is a managerial skill. Actually, it's when you managers be able to make a plan, strategic plan. But it's one way to improve your leadership step, to have a plan if you don't lead. So we remember when you said that leaders set direction while managers make planning. So if you don't know how to set directions because you don't have this integral part of leadership ability, you learn how to make strategic planning, and this way you develop one tool of leadership ability. Very important point, to be able to solve problems. I mean, this is, for me, this is one of the most important point, and the one underneath it, decision making. Because if you don't know how to solve a problem, start to tackle down the problem where it starts, the spiking points, the risk factors, and then the trigger points, and how the solutions can be done, what is the best decision to make to be able to solve the problem. These are very important, and definitely you can learn them. Definitely I learn all the time. I can tell at least one example is myself. When I learned statistics and statistical importance and statistical significance in biostatistics, I learned how by only data and numbers can improve my decision to look at the data and see how the trend of disease or how trend of a problem is growing or going. And this way I noticed that through statistics, I'm able to improve my decision and make a better decision. So this could be learned, as well. Also, reinvention is one way to try to work with alternatives and be able to invent solutions. So these tools can be learned in schools, in primary schools, university. You can take a workshop. They are very important, and be able to sharpen your leadership abilities, because I believe every one of us have some sort of leadership abilities. It's not that you have zero leadership abilities or 100%. You have some sort of self-confidence or intelligence, integrity, directionality, creativity, but you need to sharpen them. You need to purify them and make them appear on the surface. Okay, now we've finished the organizational leadership. Let's go to the higher level of leadership, which is governmental leadership. Governmental leadership is basically it's the function of the government as one unit, as a whole entity. the Minister of Health or the top level, leader in government, he or she is not the only one responsible for your health or the health of your community or to promote health. The government in general is actually the one who you can blame. And this is why when you see a collapsed governmental ability or capability, even if you change 10 different prime ministers, it will never ever make the situation better. Because from inside there are structural strategic problems that appear to be in this non-functional government that is not able to protect the population. So the governmental leadership is basically a leadership that is gained from the whole government or whole public entity, if it's Ministry of Health or Ministry of Public Health, whatever the governmental institution responsible for people's health is. So if you look at this basic figure that we all know, these are the core functions of public health, basically assessment, policy development, and assurance. It's well known, we teach it for students that when you start with any public health function, you start with assessing the problem and the condition, then you develop policy for this problem, and then you assure this problem to make sure that the policy worked. And through all of them, you have different roles of public health to monitor health and mobilize the capability and be able to build workforce, enforce laws, etc. So in this model, the government is responsible for all these steps from the beginning to the end. However, inside this, you should have leaders who are able to do and function and be able to make this paradigm works well. So without the leaders within the government is a structure, right, or a concept, or a scope of functions. They should have leaders that are able and willing to work together and as there is something very important, as we go further with the leadership abilities, it becomes much more difficult to apply leadership and be able to see the effectivity of leadership. So at the group level, leadership is easier because you have fewer people and you don't have bigger responsibilities. At the organization level, the responsibilities grows, and you have organizational goals, and you have also more people. So the responsibility it grows as well, and you have more leadership responsibility and better abilities, and the networking is a little bit more difficult. Governmental leadership is even much and more difficult and should be well considered to be considered well, because actually you have so many things, so many factors, so many people, and you are dealing with regulations, policies, laws, finances, and the goals are different, and the goals are on a national scale, not only the organizational scale. So it becomes even much more difficult than the one that is an organizational level. Okay, now we have the organizational leadership. And think about a crisis, for example, the pandemic that happened during the COVID-19. What do you think, who could be able to inform the citizens with the following? And here I would like to hear some voices from you, if you don't mind. Who would be able to provide reliable information? And of course, I would say the government, right? But can you give me examples of any reliable information that the people are expecting from the government as a leadership, or the leadership of the government, or the leadership in general in the nation? Could you please provide me with any examples, if you don't mind? Any participation? What is it? If Themios, you are here, so I can. Okay, Maria, Ministry of Health is the one responsible for the leadership in the government, especially during COVID-19. But what kind of information we are expecting, reliable information we are expecting from the government? Can you give me examples of the first one? Because we are expecting information, right? And this should be a reliable information. So what do you think examples of this reliable information we are expecting from the government? There are tons of examples. Scientific information, actual disease facts, right? So we are expecting the facts about the disease, the pandemic, the COVID pandemic. So how it happens, how many people are affected, what is the morbidity and mortality rate, what is the situation in the hospitals, how we can get a treatment, when the vaccines. These are questions basically are been asked by the citizens, right, and residents. And I see communication channels for medical committee, correct, and this is one way of effectively communicating and be able to know what source of communication we could have to receive the information. Of course, this is very good. Ways of prediction is prevention measures, as Maria said, accurate situation of the country, which is the basically statistics of the country, that everything we mentioned of the morbidity, mortality, success rate, treatment rate, vaccination rate, hospitals admissions, emergency situation, acute conditions, the spread of the virus, the transmission ways, and all kind of information. The bank, you know, if there is a bank of information where we can get data, where we can communicate, with whom we can communicate, if we need help, how we can approach help, things like that. There are so many information that people need during crisis, and the government can support them. Timelines. What do you think? What are examples of timelines that citizens need during crisis? What do I mean by timelines? Timelines that has to do with time interval, durations, things like that. We said something in the previous presentations about hospitals, when they will open, continuity of service, when we will have appointments, what time we can see the physician. I missed my appointment, can I make up another appointment? Remember, these are basically scheduling times, appointment time, follow-up with the services, continuity of services, availability of services. Somebody also, Eleni also said, for instance, timing of vaccination, when the vaccines will be available. And we have vaccinations, if that will be covering all the citizens or part of the citizens, right? Timelines of the duration, when the country will open up, when the business will open up, when schools will be able to go back to normal life, how we can be able to travel. So many things that has to do with when, how. So many examples. Ways of protection. I remember a case in Jordan when we first started with the pandemic. That was in March and April of 2020. I remember that everybody who brings a bag, even plastic bag from outside within the curfew, you know, would clean up and start, you know, adding alcohol in every bag, and even wash all the fruits with alcohol, and the fruits will taste, you know, alcoholic. And you know, measures of protection were really not clear because we did not have, you know, advanced information about the ways of protecting from the viruses. And again, mandation of masks, gloves. Remember at the beginning, I'm not sure here in Cyprus, but in Jordan, we were wearing gloves at the beginning. Then we took them out, and we only left with the masks. So anybody who would like to share any experience from here, ways of protection? Any ideas? Did you shake hands at the beginning of the crisis? We had mask upstairs, social distancing. Social distancing also very, very important. They have social distancing in churches, in every worship place, in educational settings, vaccines, lockdown. Yeah, for the also lockdown, we will mention something now about curfews and the public health leaders and their decisions. So, okay, this is the very good contribution. Thank you. So these are basically the leadership, what we expect from the leadership during crisis. We need these three factors. We need the information, we need the time, and we need ways of protection. These are the things that always the citizens think about, and the governmental leadership are responsible for this during a crisis. Okay, public health management during crisis. And I read so this one slide. I read what the WHO has recommended and what they have noticed over the time of the pandemic, how the government acts. And it was actually some of the governments act you know, unintentionally toward the recommendations that has been set by the global committee. Yeah, another. It was very strict. Yeah, it was very strict at the beginning, and we will see if really this very strict measurements are unnecessary or not. I cannot judge, but let's explore the things. Okay, so the public health management inside any nation during a crisis change, during routine time or regular time without any outbreak or emergency or crisis or a big problem that happens, the government is responsible for general things and even more specific things. But during the crisis, imagine that the government has to keep up with the global recommendations, national updates, with political problems and will. So the government cannot really oversee and monitor the minor tasks that go inside the health facilities in the country. So in the cases of crisis or pandemic, the government or the leadership has to delegate the mission of maintaining the health services. So they cannot really go over each and single activity and service and be able to see if there is any problem with surveillance system, with any problem with immunization, with any problem with distributing medications. The burden over the leadership during the crisis is too much. So what the government will do, basically they will oversee the situation, trying to set general rules and guidelines, keep up and connect with other global entities and other nations that have some sort of advancement or being able to do effort. The government also during crisis is responsible to make networking between different sectors, public sectors like transportation with public policies, with Ministry of Health, with Ministry of Education, and make them connect and work together. This is the government what will do, and be able to communicate with the public. This point, ensure the public. The government will be busy all the time to communicate and build trust and confidence and ensure the public with safety. So imagine that all these functions during crisis that the leadership of the government has to do. They have to oversee, they have to connect with other countries, other national, international organizations like the WHO, make guidelines, ensure the public makes way of communication, work to develop networking and multi-sectoral efforts. They don't have time to oversee the regular service they used to oversee in routine and regular times. So they delegate these. However, even with support, they financially support, politically support. So of course, still the money comes from the government to open the primary health clinics, to open the emergency departments in hospitals and be able. But even though with financial support, professional support with training, guidance, education, and political support, because of the political will and intention has to play a big role here, they should be dynamic. So if something does not work, they should be flexible and change something else. If something occurs suddenly, they should be able to switch off to another plan. So this dynamicity and flexibility should be part of the government during a crisis. During regular times, maybe the government will be more rigid. They have a routine service, they have a fixed policy, they follow and they don't change. But you cannot do this during a crisis. A leadership should be flexible, and they should really understand this well, how flexibility works during a crisis. And this is very important. I'd like to read these notes by some of the friends, like Georgiana. So we saw the public policy measures from the Public Health Committee in communication with the President. So there was a communication going on with Public Health Committee and communication. This is very good because I have a last sentence in the slide saying that public health experts were actually ignored and being disregarded during the crisis. At least if some public health experts were being consulted and participated to take the decision, not all of them, actually most of them were not. They were being selected, in a certain way to say the opinion of the political will and the general direction of the government. But the public health experts during the crisis, unfortunately, did not have a strong word to say. I'm not sure what was the the experience here, but at least in my country and others, the public health experts did not have a strong opinion during the crisis. They were not, I will not say allowed, but their voice were not well heard. Charles said consistently information about the essential of using face mask and social distancing all the time. Yeah, this is true for protection of the population. Okay, so this is basically how the government should work and manage the crisis, and they should delegate other tasks and change their tasks because they are busy with more important things that are looked up from the government. So this is important to know. Okay, now if we think about the leadership position and role during the COVID-19 and as an example, we almost mentioned this, but if you go again over it very quickly, who has the right? Is it the government or the public or the public health expert or the president or the king of the country? Who has the right to make the decisions regarding quarantine and curfew? Is it the army? Is it the Ministry of Health? Is it the public health institutions, the Association of Public Health, the Medical Association? Who has the right to take the decision about quarantine curfew? Okay, curfew caused a big problem. Like in my country, the curfew was for a whole 1 month in 2020, and it was some said public health department. So this is a big question. Actually, the big question is who's responsible for taking because it has consequences. If you close the whole country for a month, imagine that there will be no education, no business, no money transfer, no social relations, nothing for a month or two. And this has major consequences on the economy and the social life and the development of the country. Even 1 month makes a difference. And even quarantine, because quarantine 1 week, 2 weeks or 3 weeks, it's all difference. 1 week quarantine in hospital, which make burden the system, or you make quarantine in the house, it also makes a difference. And the duration and the time. And some countries actually finished all the precautionary measures in the next first 6 months, some of them for over a year, after they saw that there was a big crisis happening to their economy and educational system. They finished all the measures and they stopped all the precautionary measures and lifted out all the regulations regarding COVID-19 in the first 6 or 2 years. However, 2 years already passed, and still some countries have some sort of strict regulations. So who's controlling this? Who has the right to take this decision? This is just a question to ask. I don't know the correct answer, to be honest with you. Who's responsible to take all the decisions regarding this? Travel and border restrictions. Who can get in, get out? Is it enough to have vaccine, or you need a COVID test? Do you need to quarantine for 14 days when you get into the country or outside the country? These are all important questions because it affects people movement, affect travel, it affects the business, it will affect so many things. Policies on social distancing and protective measures, equipment measures, and all of that. What we should wear, for how long we should wear, where we should wear them. These are actually very important, things that are important, and we would know who's responsible to take these. To be honest with you, I would say, at least my perspective, that social distancing and protective measures are the responsibility of epidemiologists and public experts, at least, because they are the one who knows how the virus transmit, the distance that is safe for the virus in transmission, and what kind of protective equipment are necessary and what are not. So I think the public experts are the best on that. Operation of business, education institutions, and leisure facilities, also very important. Who would be able to take the decisions onto? I think many people can be responsible in this. I think this should be a multifactorial, multi-collateral, multi-collaborative work between multi-sectorial effort that everybody should take and make a voice on that. I'm sure business people will want to open it anyway, even if people get sick. Educational institutions, it depends if this is private or public. Leisure facilities, of course, if they are work for money, they want to open it. However, still the epidemiologists and public health experts have the say on this. Policymakers who knows how things working, the government who's responsible for the budget and the GDP and the finances for the government also have a say in this. So it has many people can take roles. Some of them, only one single entity can make a decision, but some of them should be multi-sectorial. Of course, operations of services of healthcare system. When should we open the services, make them available again? Should people be vaccinated when they get to the system? Are we going to open all clinics or part of the clinics? Should there be appointment, or people can walk in and take make the service? Should we work in a full load or half load or full capacity? It's all very important questions that leadership had to take. And these are all difficult questions, and this is where actually the most governments and different institutions around the world were really confused and haphazardly making decisions, because there are really so many factors you can take decision on. Vaccinations, again, we mentioned this, ways of communication, dissemination of information, and we mentioned this as well. What was the best way to communicate with the people? What kind of information should we disseminate? Should we use the social media or the TV, which people don't watch much right now, or make a special application for our people on the mobile phone and disperse the information, or make a safety application that people should use to get into the restaurants and leisure places? What kind of communication can we communicate with the people? So this is also a very important way that leadership should take. And there are communicating experts. I met some people who are experts in communication methods. They have the knowledge and abilities and information about ways of communication and when to decide on this way, on the other way. So this is also a science. Communication is science by itself. I saw also some here, and Georgiana said, in my opinion, or Joseph, I'm not sure the first name, maybe Joseph. In my opinion, the right is from the Ministry of Health, Public Health Department. For EU, for Europe example, is the EU Parliament, which is good, but unfortunately, we don't have EU everywhere, like Asia, Middle East, African countries, how they can take decision. So you have a parliament and EU, but you don't have this in other countries. As mentioned, every restraint was carefully considered by the government. I can say the government was meticulous with this here, and thank God. The problem was not all or well keeping the law and restraints. Charles said, in our country, and I'm not sure Charles is from where, we forced to stay at home for all activities ordered by Philippines. Okay, from Philippines. So this is very strict, and there is a website where you can monitor, and I kept monitoring the countries just for my own curiosity in the last year or maybe year and a half. It's from IATA, and IATA basically is the International Association of Travel, but they keep updating all country rules one by one and the restrictions. And I still remember the Philippines, until now they have a little bit of restrictions now, not like before, but they used to have severe restrictions. I was surprised that all South Asia actually have severe restrictions at the beginning, and until recently they started to leave out or starting lifting the regulations and limitations. Although all South Asia countries were depending or still depending on tourism as a income, national income source. So that was something challenging for the population. I'm sure in Philippines and other countries in that region they were completely demanding and the opening, especially many people who were working in the tourism side. I'm sure Charles can affirm this. Efthimus said it's very complicated from perspectives necessary to develop a community of experts. Yeah, Efthimus, it was developed in many countries, but unfortunately, it was not effective all the time. And we probably can talk about it, but this is big. So, the committee is basically governed by the government, and guided by the government. So you are not really sometimes hearing the opinion of the experts the way they should be heard. So it's true if it's pure, you know. Okay, just quickly there are two modern models. These are not you know, old model of decision making during crisis. This is a Giuliani model and a Glendening model. So Giuliani is a politician in New York, and he was a New York senator and governor for a long time. Also, he was a supporter of during the Trump administration, and he took, you know, very, you know, I would say brave decisions, or you know, some sort of confusing decisions during his you know, position time. But anyway, he has a thinking, and he said that repetitively several times, and that was his strategy of operating his leadership, is that political leaders make the decision and expert advice. So all kinds of decisions, and he made decisions, several decisions of talking about vaccines, refugees. He made several decisions actually. This is why I said he made these, you know, confusing decisions. So he believes they are the ones who take the decisions about any aspect, about any issue, regardless if this is health, educational, political, you know, social, doesn't matter. But you know, the expert advice, and some points the experts are not listened to. Glendening from the other perspective is basically an academician. So he believes, as an academician, as somebody who works in science, the public health leader makes a decision that has to do with a public health crisis, but political leaders support the decision. So they are not support with the opinion, they support with the decision. They support the decision. Basically, they make the decision go through the political channel and work through the government. So we have two different models, and we will ask questions and exercise about these models. So the first model is the model when political leaders take all the decisions, make all decisions, and just, you know, take the company of the expert opinion. While the other model is the one who takes the decision is the public healer, and the political leaders only support. Okay, so if we make a decision about the two models, the first one the political, the first one is academic public health expert, which one would you think make a higher consideration for the society? So there is a higher society consideration. Which one? The political way, without you know, just the only one who are, you know, taking decision, or the other one, the academic or the public health expert? Which one do you think? Any thinking? Okay, so think about it. Maybe I would prefer the, you know, to think about the public health experts who think about the you know, the considerations. Okay, political will and balance. If you think of politics, maybe politicians will think about it even more. Health considerations. This is very important. I would go 100% with public health experts. They are the one who should take the decision, because they know everything about epidemiology, public health management, the control of disease, things like that. Economic interest. Economic interest. Now I have to be with the side with the political, you know, leaders who are aware of the economic interests and how the economy is working within their area or the country. Legal and ethical issues are something to think about. Who's the one who's more aware of taking decisions about, and public opinion is another factor. Okay, during the crisis. Okay, this is important, but I will go a little bit quickly on this. Leaders are officially assigned, and this is a problem that we, Euphemius and Charles and others were participating, saying different opinions about this. The problem during a crisis, leaders do not appear as and show up their own ability and the ability of being unofficially lead the people and the public and be able to participate in the community. They are officially assigned. That means they take a position from the government, and you know, they assign somebody who's well known to them, you know, maybe are aware of political will and political decisions. So these leaders are basically not 100% leaders, because they are officials working for the government as leaders. And we have seen this And I can give examples, different examples in my country, other countries, that there are many people who are not public health leaders were assigned in a top roles and important official positions during the crisis to take decisions about the crisis. And that was something difficult, honestly. Leadership takes the political shape, of course, during the crisis because they are within the government controlled and monitored and participating within the government decisions during crisis about restrictions, regulations, mandates, things like that. Okay, decisions and judgments are difficult to take during the crisis. And although you have a very short time to take a decision, so if an outbreak happens and the vaccination comes, and if a policy came out saying that kids, for example, should be vaccinated, or if you want to make a decision about schools or open or not, you don't have a lot of time to take a decision. However, the very unfortunate fact, it's a fact, that usually you need more time during a crisis to take a decision because the effect will be higher than regular times. So in regular case, if you take any decision about vaccinations or stopping a service or opening a new center or whatever, the decision will not have an effect as it is during the crisis, because everything in the crisis becomes larger, it explodes higher, So decisions are harder, although it takes time, should be taken within a shorter time, unfortunately. Again, effective communication. I cannot really reiterate more on effective education and the importance of education, communication, sorry. The importance of effective communication during a crisis. It's the very important key factor that would make people trust you, seek the information, and know the ways of protection, and be able to protect themselves, and be able to trust you, and be able to be guided. Effective communication is the most important part during a crisis regarding the relationship between the government and the people. Okay, the end result of all of this, it's not that you failed by 50% and you succeed by 50%. The people will judge you by you failed or you success. So as a government, and this is very important, anybody who works in the government and probably hear that, it's either they hear the voice of the people that the government succeeded or the government failed. You will not see something in between. They are either succeeded or either failed. Okay, during the 2-year leadership I am just putting out these questions to think about, who had succeeded from different countries and government, and who judges? And I am leaving this question open because we don't know if, for example, Australia succeeded more than Cyprus, and Cyprus succeeded more than Jordan, and Jordan succeeded more than Egypt, and Egypt succeeded more than Congo, for example. We don't know who judges. Did we make a scale or a certain criteria to judge the crisis and be able to judge the leadership? We don't know, but it's actually very important to know if you have succeeded or not, because in many occasions different crises might come and leadership is again needed. So how we can do? Can we know? Can we be able to judge ourselves? Somebody else can judge us. This is very important. Could the leadership effectively control the pandemic? This is another question. Any leadership, your leadership here in Cyprus or any other country, could that? Do you trust it again to be able to lead you through another pandemic? This is another important question. Are they able to control future pandemics? Have they gained their citizens' trust? Did you trust your? I'm not trying to make anybody to fall into a problem here, but I'm just asking questions. Did I trust my government during the pandemic? Did you trust your government during the pandemic? Did they make the right decisions? These are important questions. Do you think they should make the same decisions in the case COVID-19 hit back again? Okay, are they willing, the government leaders, are they willing to hear a feedback? Do you think your leaders, or leaders, if we have any leaders here with us today, are they willing? Are you willing to hear a feedback from the people of the government? This is important. If I was responsible, a little bit in any of these occasions, I would ask kids in the schools, I would ask healthcare providers, I would ask the public, I would ask the elderly people, I would ask employees in different governmental, non-governmental, private sector, business people. I would like to hear a feedback about the role and the ability and the capability that the leadership of the government has achieved and did during the pandemic. Okay, did they change any health behavior in the future? Did they change anything? Have they improved anything in the healthcare system? Okay, and this is the last thing is important, because if you don't learn from your mistakes as a government or as a population, if you don't learn from your mistakes, if you don't know where the gaps are and try to improve them, then you have benefited nothing. So of course, during the pandemic, you found maybe your emergency system is lacking. You have a workforce problem. Joseph saying, yeah, we should think about that for the pandemic. Maybe you have some problems in your primary health care. So you should think seriously and collected data during, as a government, leadership, collected data during this crisis and be able to benefit from this data to improve your healthcare system. Because the healthcare system, routine cases, again, with minor problems, you will not see the defects. With bigger problems and serious, issues, health issues and outbreaks, the defects will appear on the surface and will be very big and very obvious to everyone. So this is very important to learn during the pandemic of the 2 year that just passed. Okay, we mentioned this again. Leadership can be trained, and again, you can train that in everybody. You can look here. Why we don't have exchange programs to teach leadership from other countries to benefit from other health systems that were helped during this? Why we don't have public health programs that teach leadership for all? I was thinking, just personal thought. If you go to the university, we know that physics, mathematics, chemistry, biology courses are mandatory for every science major, right? But I was thinking, why public health course, introduction to public health? Because public health is actually a course that overview all health-related issues. So why we don't have a mandatory public health course in all sciences majors? I mean, this is something to think about. Why we don't have this? I mean, public health experts, we should actually aggregate and advocate for this. Public health leadership and leadership training for leaders. We know that we have leaders, but maybe they are not real leaders. We don't have training of leaders. How many leaders we have in our governments don't know how to professionally use the computer? They don't know what are the communication skills. They don't know how to deliver a message. There are so many leaders like this. I mean, they should be trained how to be leaders if they are pushed to be leaders. Okay, this is I think maybe the last slide. Global leadership. This is the last level, and this is the most higher level, which is the global leadership. It's, as I said, it's a multinational, multi-agency work effort that everybody share and everybody collaborate this. There is no specific country who's leading, so we cannot say, for example, USA is leading the global leadership during the crisis. There is nothing like this. It's a shared value, shared issues, shared solutions. So everybody is responsible. Everybody is participating. If you have a research or an important finding in one country, this country should share the others. If you have a pandemic or a new variant that is appearing because of the pandemic, COVID-19, everybody should know. And we know at the beginning, I will not try to take into this, but at the beginning, some countries tried to hide what's happening. There was, even the WHO honestly was late in announcing the facts about COVID-19, and so many countries blamed the WHO. After that, WHO started to work more effectively. So it's very important to have this multinational, multi-directional sharing of knowledge. Again, it takes shapes, many shapes, this global leadership, even funding, collaboration, assistance. And assistance can be technological assistance. You can teach other countries how to do telehealth, how to do telemedicine, how to support their public, how to make a good communication method. There are so many ways of assistance and collaboration. Of course, global problems are not only COVID-19. There's climate change. We can always share and collaborate with this urbanization and other things I mentioned here. food problem, malnutrition. So global problems are many. Now COVID-19 actually is getting our brains busy. But before COVID-19, it waked us a little bit more. But before these global problems, there were other global problems that should the global leadership be responsible for and think about. And again, the global leadership is not only somebody. It's a global effort of leading the globe and leading the general public around the world toward their benefit and their health. Okay, this is what I quickly presented and tried to share with you. I'm very happy that we have this discussion today. And Charles, Euphemius, Joseph, many people were very active. Thank you for sharing the information about the country or the place where you work at. Anybody? No question about leadership or but what the problem of the evolution of mobilization of the financials. Yes, the Charles is sharing his experience in Philippines, like the big demands and very lack of supply, which is all correct, insufficient fund for the people. And this is how the leadership could take a decision. If you don't have funds and money for the people because of the lack of jobs and work, because Philippines basically rely on tourism, so you should think about restrictions. So Lada asks, what is the topic for tomorrow? It's telemedicine, telehealth, which is one way of current and recent way of communication in delivering health. Thank you everybody. Thank you everyone who participated. I appreciate everybody and thanks for allowing me to discuss this topic with you.